Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. This is Josh Sharfstein. Today, a special podcast about a special person, Congressman Elijah E. Cummings, who served in public office in the Maryland General Assembly and the U.S. Congress for more than 35 years and who died in 2019. I speak with his widow, Dr. Maya Rockeymoore Cummings, about the origins of the congressman's relentless and successful advocacy and leadership for health. A brief note, this podcast includes unfiltered stories of racism. Let's listen. Dr. Maya Rockeymoore Cummings, it is so great to talk to you about your late husband, the Honorable Elijah Cummings, who represented Baltimore in Congress for more than 2 decades. I had the amazing honor of working with him when I was the health commissioner of Baltimore, and just seeing how many health issues he was involved with and how deeply he cared about those issues. But, I never got to ask him why. And so I want to start with you on that. Why was health so important to Congressman Cummings?
Well, Dr. Josh Sharfstein, let me just say thank you for having me on. Elijah, it was this great honor to work with you, and he held you in the highest regard and esteem. And so, I think it's fortuitous that we're discussing this today. Elijah grew up in, a family that comes from the Jim Crow South. Of course, Maryland is the Jim Crow South, but they came from South Carolina. And one of his earliest memories was his father telling the story of his father's death and how it went down. And he never forgot it. It's something he recounted time and time again. And the story goes like this. Elijah's father was a little boy, and his father was a preacher. And he preached one day and, basically fell down in the pulpit. And they took him back to his homestead, the homestead, and they called the country doctors. The country doctors were 2 white men, an older man and a younger man, who showed up. And they went in and assessed Elijah's grandfather. His father was sitting on the porch as a young man, and he overheard the 2 doctors as they came out. And the younger doctor said, if he doesn't get care soon, he's going to die. And the older doctor replied to the younger doctor, and they didn't notice, I guess, the little boy sitting over in the corner. He said, "Oh, don't worry about it. He's just a nigger." Mm. And that seared in the brain of Elijah's father. Mm. And his father indeed did die later on that night. Mm. But it seared in his brain that there was a basic lack of care. In this case, it was interpreted as a lack of care for a Black man by white physicians. And he recounted that story to his own family time and again. And Elijah then recounted that story time and again to his family and certainly to public audiences. And it's in his book. It's one of the opening stories in his book. So that was a foundational kind of perspective that Elijah had on injustice in the healthcare system.
That is really a intense and critical story for understanding Congressman Cummings' deep interest, not only in health, but how health for him was linked inextricably to justice.
Absolutely. It really was. And, that carried forward in his life in terms of his own personal experiences, and that is his family. He lived in a low-income household, and, there was no going to the doctor in many cases. It was home remedies. And sometimes those home remedies failed, especially when it came to dental issues for Elijah. And there is, he had a lifelong passion for making sure that people had access to adequate dental care. that came back up actually in a legislative sense later in his life when a young boy in Maryland his name was Diamante Driver, died of a tooth abscess. Basically, he had, a tooth abscess where the bacteria went to his brain. They could not find a dentist who would take Medicaid, and he died. Now, I remember we were sitting here, I was reading the story in the newspaper, it was in the Washington Post, and I started crying. And Elijah asked what I was crying about. And I said, you've got to read this story. And he read this story, and it seared him in his heart. So much so that he took it up as a personal cause. And he worked with associations in Maryland, dental associations and national dental associations. And Maryland went from like 49th in the United States in terms of access to dental care for Medicaid recipients to like number 1 or 2 as a result.
It was number 1, Maya, actually. And I came into working at the state level just after that horrible tragedy had happened and a whole bunch of changes had been put into place. And I actually think you may even be understating Congressman Cummings' role there. I mean, he made it the number 1 priority for everyone. He was everywhere talking about it. You could tell how deeply he cared about it. And he had this effect on people. It resonated with them, and they felt like their job was to take action. And Maryland became number 1, actually, in the country with an enormous investment. And not only that, so many people working so hard to see that vision through.
Absolutely. And it was all driven by the fact that, of course, Elijah was deeply empathetic. He cared passionately about people. But by the grace of God, Diamante's story could have been his story. Because Elijah's, his teeth journey, his dental journey was not a good one. And he had to, unfortunately, have, false teeth in his later life.
I did not know of that connection, actually, despite being involved a little bit myself in that actual story. Let me ask you about Congressman Cummings working for a pharmacist as a child.
So Elijah, he was always a go-getter. Started working like at the tender age of 8 or 9, delivering newspapers. But in his neighborhood, when they moved from South Baltimore to West Baltimore, Elijah went into a pharmacy one day and asked if he could work with, and I'm forgetting his name. Do you know his name?
It might be Friedman. Is that possible?
So Dr. Friedman was a pharmacist who had a pharmacy in Elijah's neighborhood. And he invited Elijah to work for him. And so Elijah ended up, doing everything, including filling prescriptions. And it was fascinating for him. He got an opportunity to get paid, get well treated, because Dr. Friedman became like a mentor to Elijah. He was very kind to Elijah, and Elijah never forgot that kindness. And he, learned a little bit about the prescription drug business, and certainly about the ailments that were facing members of his community. And it was an experience that was indelible for him. He never forgot it. And I think that he's also connected with the descendants of that pharmacist. And they were grateful for Elijah telling their father's story.
Well, what is so interesting is he's talked about how he saw the value of pharmaceuticals, how necessary they were for the people that he worked with in that role. And then fast forward a bunch of years, and he becomes the leading advocate for making prescription drugs available and affordable to people across the country.
So I've got to tell you that was also spurred by his own experiences. Elijah had cancer for a long time. I think he was first diagnosed in around circa 1995 with a very rare form of cancer. And he recognized that in a way he was privileged because of the work he did. He had access to the prescription drugs that would extend his life for so many years, but he understood completely that other people who, particularly those who were low income or African-American from his neighborhood, did not have that kind of access. And another story that actually reinforced that was when he was in Hopkins, for one of his, extended stays, unfortunately, later in life, he was doing physical therapy so that he could, regain his walking function. And he was in with another woman who, one day he learned that he'd become friends with her because, Elijah became friends with anybody. If you're seeing him on a regular basis, he's asking you how you're doing. He's asking what's going on. He became friends with her and he said, "Oh, I hear you're getting out. You must be happy to be getting out." And then she just burst out crying. And Elijah said, "Why are you crying?" And she said, "While I'm in here, I can, at least get treatment, but I cannot afford the cure once I get out." Wow. Meaning that she could not afford the prescription drugs it was going to take for her to help her stay alive. And Elijah took this as a personal mission. He was a very vocal advocate because of his own experiences, but those that he constantly heard from his constituents and others.
He famously tried to get Donald Trump to see his way on this issue. And when that failed, he kept pushing. And the Democrats named their big prescription drug bill after him.
So I was actually there at the inception of Elijah's advocacy for Donald Trump. You want this story? So we didn't know if we were going to the inauguration of Donald J. Trump in January of 2017. And so Elijah, we debated at home. Elijah talked to his colleagues. He famously went to John Lewis, who was calling for a boycott of the inauguration. And finally said to John Lewis, "Look, I've debated, I've deliberated, I ruminated, and I think I'm going to go." He said, "I think that the institution and my role in this institution is more important than, signaling my opposition to this president." So we went. And afterwards, we were invited to the luncheon. And we were seated at the table with Donald Trump's relatives, which was fascinating. Anyway, halfway through the meal, he said, "You ready?" I said, "Yeah, I'm ready." So we get up and we go to the front table where Donald Trump is seated. Next to him is Melania on one side, but standing next to him is Mike Pence on the other side. So Elijah introduces himself. He introduces me. There were a couple of niceties. And then Elijah launches. He says, the American people are getting a raw deal. And I really think that, that we can work together. This is something that Democrats and Republicans care about because, they're getting a raw deal on prescription drugs in this country. And people are dying, man. People are dying. And to his credit, Donald Trump said, yeah, well, that sounds like a good idea. He said, and he turned to Mike Pence and he said, "Pence, let's make a meeting happen." And so Elijah, I think, was one of the first Democrats to actually meet with Donald Trump. And he goes to the office famously. He takes Redonda from Miller from Johns Hopkins University because he wanted an expert with him to talk about what was happening. And then they go into the office, they hold this meeting. Elijah's thinking that Donald Trump is listening carefully and is empathizing with him and agreeing with him, and that he actually thought they were going to get something done. He walks out, and apparently Donald Trump walks out of another door and goes to talk to the media. And that was Elijah's first very bad taste with Donald Trump because Donald Trump ends up lying. And basically, indicating that it was just terrible. Elijah realized at that point that Donald Trump was really actually beyond redemption in terms of his ability to work cooperatively on this issue and many more.
It does speak to Congressman Cummings' willingness to go not just the extra mile, but also the extra mile after that, to help people who he knew were really hurting. The bill that was named after him, eventually some of the major provisions actually became law in the Inflation Reduction Act.
Elijah was a staunch champion for reducing prescription drug costs. And after he died, his colleagues actually named a bill, the Elijah E. Cummings Reduce Prescription Drug Costs Now bill, I think it was called. And that passed through the House of Representatives twice. It did not pass through the Senate, I believe, and it never became law as a standalone bill with Elijah's name on it. But portions of it were then integrated into that Inflation Reduction Act. And So as a result, now we finally get something that Elijah advocated for forever, which was Medicare's ability to negotiate certain prescription drugs, which is expected to actually not just have cost savings for Medicare, the Medicare program and Medicare recipients, but to the extent that the private sector and industry actually follow Medicare, that it'll have an impact across the board. And that is a beautiful thing for the country.
Now, I can think of so many other areas of public health policy that Congressman Cummings was engaged in. He was a force for the Affordable Care Act to get people health coverage.
He certainly was. And what stands out to me for that story was I came to visit him on Capitol Hill the day it was passed. Mm-hmm. And we walked outside of the east side of the Capitol, and we kind of went to lean on some stone, a stone ledge that was nearby. And his sense of satisfaction and happiness that passed was so palpable. It felt good. We were on a high because we felt that finally the legislative process was working for the American people in a way that would make a massive difference for people across the country. And indeed, my organization did a study of the Patient Protection and Affordable Care Act. And we found that it actually closed disparities in access to insurance for Black and white children. Every other racial and ethnic category across genders experienced more access to insurance. And so if we ever want to say that we can't close or address health disparities, whatever they may be, we actually have in the Affordable Care Act an example of exactly how we can do it.
Well, I want to tell you a story because during the Affordable Care Act implementation, I was the health secretary of Maryland, and our exchange did not launch very well. That would be arguably a major understatement. And I fielded a lot of phone calls of people who were very angry. And when I saw Congressman Cummings calling me, I kind of, partly girded myself because I just felt so horrible, feeling like I had disappointed him when we couldn't get people insurance the way we had hoped through the exchange. And I answered the phone, and the first thing he said was, "Josh, I'm calling to see what I can do to help. What do you need me to do?" And I said, "I know this is crazy. Would you come up to Baltimore and do events for people to enroll in person?" He said, "How many do you want me to do?" And really unique among almost everyone that I dealt with. He had his sleeves rolled up when we needed an extra push to get approval to unplug the broken computer system and plug in a new one. It was Congressman Cummings that I turned to, and he's the one who made sure that people stuck to their word and gave us the approval, and that system worked. And he then kept doing events now with the system that worked. And he was just relentless in getting people signed up for coverage. So, I have a feeling this podcast could last for a long time because there's so many different topics. I think of him very early on with Medicare Part D, making it possible for older adults to get signed up. I remember I was actually did an event with him where I spoke, and I don't think anyone paid attention to me. It was over a dinner at a senior center, and Congressman Cummings got up, and the first thing he said was, "What are you all having for dinner?" And then they all answered him, and he said, "Well, they haven't given us any dinner, but why don't we talk about this?" And before you know it, everybody was literally eating out of his hand. He had everybody ready to learn about what they could do to sign up for the drug benefit. He had just an incredible warmth to him that I think made him just so effective at connecting with people.
And he knew how to approach. He often talked about that he would get to a speech early because he wanted to feel the room. He felt like he could, sense the essence of what they needed to hear by, just absorbing the energy in the room prior to his speech. And so the story of him not starting with prescription drugs, Medicare Part D, but starting with what are you eating? He knew it would get them, grab them. He would also often use humor as a way to engage people, and it always worked. People appreciated Elijah. They felt his spirit, and he felt theirs.
So I want to end with the fact that Congressman Cummings worked quite hard on issues that other people didn't always pay a lot of attention to, where there was a lot of stigma, there might be discrimination. HIV comes to mind, drug addiction comes to mind. He was extremely outspoken about the importance of following evidence to support programs that would literally save people's lives. And, you tell a story in the book about when you asked him whether he was worried about the stigma if he took on HIV. And I wonder if you could help me understand, he didn't seem to pause at all as he jumped into these issues, even though a lot of other people did.
Absolutely. So people don't understand that Elijah and I met because he was the first member of Congress to give me an interview on my dissertation, which was on the African-American political response to HIV/AIDS. It was a study of the Congressional Black Caucus in the 105th Congress. He was one of the first members of Congress to give me an interview. So I walk into his office and I have all my prepared questions. And pretty soon we were rapping and chatting. He was telling me about, this program that he had helped and he had been involved in with his church on HIV/AIDS. He was talking about, how it was such a problem and how, what happened in his church was like an eye opener for him. That, suddenly all these Black men started disappearing and, he wanted to do something about it. And he did, lo and behold. And at the time, there was all kinds of controversy around needle exchange. And he's like, we need to do it because, the science says that this is it. And he was not at all caught up. I asked him specifically the questions. And by the way, I think I'm not supposed to be revealing my human subjects. This might be a violation of the scientific code of ethics with regards to human subjects because it was a part of my dissertation. But I labeled him as a result of all of his forward thinking, as a result of his explicitly saying, I don't care about the stigma. I labeled him in my dissertation, and this was way before we ever dated and way before he was ever my husband, but I labeled him a transformational leader. Everywhere you turn in Baltimore, addiction is an issue. He knew it was an issue for his community. He knew it was becoming a greater issue for people across the country. And so Elijah tackled addiction on multiple levels, working with, the local officials, health department and state officials. But even at the federal level, he tackled this issue. He tackled it. He and Senator Warren introduced a historic bill on opioids, where they were seeking to direct, hundreds of millions of dollars to jurisdictions across the country in order to challenge the opioid epidemic. And then, he actually did a series of hearings about opioids themselves and the Sackler family and their role in terms of, facilitating the addiction of the country. And some of the information that came out of those hearings served as the basis of the lawsuit that the AGs, attorney generals, launched against the Sackler family, and now it's resulted in a historic settlement where finally jurisdictions across the country are getting resources to address it. So. Elijah was amazing. And he did all this, by the way, with cancer. He acted every day as if it was his last because he knew he was racing against time. And he dedicated his life to helping other people. And it literally was, a tremendous thing to see. And I feel honored and privileged to have been a part of his life.
Well, it is just a remarkable legacy, And this conversation just brings it all back, brings it all back for me and for you. And I remember not only, how much I loved him, but what an unbelievably special experience it was to be able to spend time with him and to work with him and to follow his lead. It was just one of the honors of my life. Thanks so much for joining me, Maya.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.